Are you a woman interested in an integrative doctor's guide to mastering midlife hormone shifts? Well, you're in the right place. Hi, I'm Dr. Patricia Mills, holistic medical doctor, and welcome to the Wild Wisdom Show. I am so pleased to have with us today special guest, Dr. Angelina Yee. Hi there.
Hi. Thanks for having me on the show.
It's our absolute pleasure. Angelina, you're a graduate from the University of Toronto Medical Program. You did a fellowship in Integrative Medicine from the University of Arizona. You did some training in functional medicine through the same institute that I did, Institute of Functional Medicine. And additionally, you did some hormone optimization with the American Academy of Anti-Aging Medicine. And you told me when we met before this that you are truly devoted to helping women transform midlife burnout, just so related to hormone health, into ageless vitality. So thank you so much for being with us today.
Yes, it's personal and dear to me because I think this has been my journey as a very conventional doctor, going through the stages of burnout and then hitting perimenopause and sort of feeling like the carpet was pulled from underneath me and really trying to figure my way out, and then realizing that I actually had all the tools that I had learned and not really, like, looking back, really being able to connect the dots and realize this is really where I can serve the best.
I love that. And we have a very similar background. In fact, we even graduated from the same medical school. So that's really cool.
That's
And
right.
yeah. And I think that, you're very well positioned to talk about what is the difference between conventional medicine, which is what the training we receive in, medical school, and then doing our residency. You did a residency in family medicine. You work as a hospitalist still in the conventional system. So you're deep in that very important work, very crucial work. And also you are practicing more of an integrative medicine approach based on your own personal experience and your additional training. Can you, let the audience know what is that difference and how is that important when it comes to women's hormone health?
Yeah. Oh, such a big topic. I mean, when we go into medicine, we really think, like, as doctors, you really approach it like you're going to, like, heal the world. And I think we go in with a real wanting to heal. What I don't think a lot of us know is that you're going into medicine to really provide sick care, which is an aspect of healing that is crucial. So for acute illness or acute injury, we're very well trained to manage those aspects of care. And where an integrative approach comes in, however, is really on the side of prevention and longevity, and not necessarily dealing with an acute illness. Like a perfect example in family medicine, when we are taught preventative care, our idea of preventative care is really screening for disease. We make sure our patients get their pap smears. We make sure they get their mammograms when they hit a certain age. But what are those looking for? Those are actually screening for cancer. And so we're looking for disease, but we're not really talking about everything that can be done up until that point of how do we prevent it? How do we keep people healthy? How do we, even if they're starting to show signs of movement towards disease, how do we bring them back and prevent that from actually happening? So there, the integrative piece really starts to look at that and brings in other tools that aren't always available in our conventional medicine setting. Because when you're dealing with acute illness, we often will rely on symptom management or acute strategies, surgery, antibiotics, etc. But there are many, many, many tools available to healing. There are a lot of ancient wisdoms from a lot of healing systems that have been around long before our allopathic medical system has been around. And being able to tap into those, I think, are so beneficial. So not that I'm an expert in those areas, but I certainly can help guide towards those areas and just really have a much wider perspective of what it means to be healthy and to heal.
I 100% agree. And what the state of affairs that is nowadays in terms of when you go to see a doctor that has been conventionally trained is that unless they've done additional training beyond what we're taught in medical school, reflecting back on our training, it was amazing training. We got lots of training in anatomy and physiology, how the body works, how the organ systems function. And then we jumped to how to diagnose disease and then treat it using primarily medication and surgical tools. Now, that in and of itself is not bad, but that jump, right? What ideally would have happened and hopefully will happen in the future is that we're taught what are the factors that then cause that disease to occur, so that when you do screen it and pick it up, you have an understanding, first of all, of why it happened, so you can educate the patient. These are the things that happened along the way to trigger this. So if you want to heal the condition, you have to change the lifestyle that created the condition.
100%, 100%. What you just said, like completely, conventional medicine is, we are trained exactly for that, to recognize disease. So it becomes a bit of pattern recognition of, do these symptoms and do these physical signs fit into a pattern of disease that I have, that we've been taught and trained to look for? And then what tools do we have to help with those patterns of disease? So what I see so commonly in women's health is that women will go to their doctor and they'll say, I'm just not sleeping. I feel so much more anxious than I normally do. And they start to explain a lot of the symptoms that start to happen in perimenopause. And unfortunately, and this was actually a big push as to why I went into integrative medicine, because unfortunately, when you look at pattern recognition, what fits into that pattern is anxiety, it's depression, it's insomnia. And then you get prescribed certain medications to help with that: antidepressant, sleep medication, sometimes the birth control pill, but not even, because that's not usually even that step. And that was actually one of the big prompts. Was a close friend of mine had that very experience, and it was like hitting me with a ton of bricks to say, oh, wait, there is another way. We need to look at this entirely differently.
I love it. And also, these stages of life are not diseases.
Exactly.
They're stages, and they can be in good balance. You can have a well-balanced perimenopause and menopause experience, or you can be out of balance due to root causes, which are very common amongst women due to the way we live our life, the modern settings, things that if we had greater awareness around, we could change and optimize and shift and strategize, and then you would be able to have a better experience in those life stages. So why don't we talk about your approach as an integrative medical doctor, in terms of how do you progress through when someone presents to you now with this, different level of awareness, a more integrative lens.
Mm-hmm.
Someone presents to you saying, I'm experiencing these signs and symptoms, whether it's problems with sleeping, irritability, the weight gain, the brain fog, whatever it may be that person's having in their life. And so now, what kind of pattern recognition do you go through that's different from conventional medicine? And I have up here, if you're listening to this on the podcast, on YouTube, I have a banner and it has Dr. Yee's approach, kind of like the guide that we talked about at the beginning to mastering that midlife transition, perimenopause, beyond, perimenopause, menopause, and beyond. And she calls it the Ageless Alchemy. And the pillars are body attunement, hormone balance, mindset reset, advanced longevity. And when I read your description of that, I was very interested. So I'd love to go deeper into that for sure. And then the last one is connection. So as you talk us through, that person presenting to you, the pattern recognition that you go through, and then the approach using this, the signature guidance would be really lovely.
Yeah, I love it. Thank you. So really, the first step is body attunement. I mean, when a woman first comes to me with symptoms, sometimes my first question is, okay, have you noticed any patterns in relation to your cycle? A lot of women, surprisingly, are like, no, I have no idea. I think you touched upon something like just understanding the process of what is going on in your body can be incredibly empowering. And there's so much that can be done when you're talking about the preventative and optimizing side, that even just understanding it can be such a huge motivator to be able to adopt some of these lifestyle changes that would make a huge impact. So when I talk about body attunement, it's really just about learning to pay attention to the signals that our bodies give us. That can be anything from the symptoms that you might be experiencing and at what time in the cycle they occur, because those will match up with hormonal imbalances. And it provides not only me a lot of information about what balances might be occurring, but also what hormones might be involved, because different hormones have different symptoms and different presentations, but also what kind of lifestyle changes are having an impact on you. So, I think why perimenopause can be so difficult for some women is because we sail through our 20s and 30s doing a certain thing, and our bodies support that. Our bodies are able to rebound. And so if we have to stay up all night for whatever reason, we can get up the next day and we can function perfectly fine. We're thinking clearly, no problems at work. But when you start to hit perimenopause and those imbalances start to happen, those lifestyle habits or things that you've been able to do in the past don't necessarily work well for you now in this stage of life. So really paying attention to the impact of the choices that you start to make with respect to lifestyle, as well as just like if you're going to make a change, as well as your mindset, like if you make a change, what can come about? So one thing, for example, is a lot of women, what I see so commonly is start putting on a little bit of weight. And prior to this, it was like, okay, I can just double down. I can work a little harder at the gym. I can count my calories. And so many women come to me and say, it's just not working anymore. It doesn't work. I don't know what to do. All of my strategies that I relied on in the past no longer fit. So what can I do? And part of that, what I teach them is pay attention to your body. The reason why there is so much out there in social media right now, and it can be super confusing about what we need to do in perimenopause, is because there is no one size fits all. If there was, we would all do it. It would be simple and there wouldn't be any confusion. But what works for you in this particular moment, the only way you can figure that out is by tuning into your body. And sometimes you need help with that. And that's where I come in. I can help guide you and I can help make the links, because sometimes it's hard to see the links of I do this and then this happens. So
what are some common, and this ties into that second pillar, hormone balance. What are some common things, signs or symptoms that a woman would experience that would trigger you to think, oh, I think it's a problem with this hormone? So could you give some examples, almost like mini case studies of, what you see and you think, oh, that's progesterone or that's thyroid, or, what crosses your mind?
100%. Okay. So the most common hormone that starts to get depleted in perimenopause is progesterone. And that can start actually in your mid 30s and start to become more and more prominent. Looking back, it's always clear, but how that can present is usually in the second half of the cycle. So the 2 weeks, let's say, before your period, you could start having impaired sleep. So where you could be a fantastic sleeper, all of a sudden you're just not getting that deep sleep. You might actually even get night sweats. That's actually how I started presenting. You might adhere to this. Again, we were taught disease. So I had drenching night sweats. And I thought, do I have lymphoma? Because we were taught B symptoms, night sweats could be cancerous. And, here I am, a really healthy mid 30-year-old going, what disease? How does this fit into my disease pattern? And the only thing I could think of was cancer, not perimenopause. And it was only when I started digging a bit deeper in this space that I put two and two together, that low progesterone can actually lead to night sweats. And I think this is also, I'm just going to digress for a second, why this is such a different area is because these symptoms are a slow progression. These imbalances happen very slowly. So when you first get the one-off night sweat, you don't think anything about it. Or when you first get that anxiety sort of attack, and not even a panic attack, but just like that little first anxiety, you don't think much of it until it starts to become more pervasive. But this is something that can develop over years, really. Other things could be progressively heavy periods. So you might find, and again, that is because estrogen is a building up of everything. It's an activating hormone. Progesterone is the opposing one. So it keeps everything in check. If your progesterone is coming down, then your lining can get grow sort of unopposed. And then when you do have your period and it's shedding, it can be very heavy. Similarly, estrogen being growing can cause breast swelling, breast tenderness. So again, if you don't have progesterone to keep that in check, those final 2 weeks can feel, if you've ever been pregnant, like you have really tender breasts, and that can be a cause of it. Headaches, same thing. Migraines, again, oftentimes hormonal cyclical migraines can happen in those 2 weeks before your period. So there's a whole host of sort of worsening, and then symptoms, and then there's the mood symptoms, the irritability, that sort of traditional PMS type of picture. That again is from the relative imbalance of still making adequate amounts of estrogen, but not enough progesterone each month. And so you get this imbalance.
It's amazing. And I don't think many women know that the hormone that tends to decline the most at first is progesterone. We tend to think that estrogen is most affected. And so we look for those estrogen deficiency signs. We might Google that. But the progesterone deficiency signs, that body attunement of especially those 2 weeks before your menses, your menstruation, sound very, very key. And just at a high level, we immediately think about prescribing progesterone, for example. But what are some strategies that you might lead your clients through that don't involve the prescription first?
Yeah, no, 100%. So part of it is understanding the imbalance, right? So it's a relative imbalance of a lot of estrogen versus compared to progesterone. So what you want to do is optimize how your body processes out estrogen. Estrogen can be seen sometimes in your body like a drug. So your body produces it, but like everything else, it has to be processed out. It gets processed out in the liver. So there is a lot you can do, optimize nutritionally to ensure that your liver metabolizes, which basically is a fancy way of just saying packaging up the estrogen into molecules that your body can then excrete. And the way we excrete the molecules, once they've been conjugated and processed, is by having bowel movements. So again, things like making sure that you're super well hydrated, that you're having regular bowel movements. Incidentally, one of the other signs of low progesterone is constipation. So that can further make these perimenopausal symptoms worse. So that is really important to make sure that you have lots of cruciferous vegetables. So broccoli, kale, Brussels sprouts, bok choy, all of those provide the necessary cofactors for phase 1, phase 2 detoxification in your liver. And then that packages up the estrogen, and then lots of good fiber and hydration to make sure that you're having constant bowel movements, or regular bowel movements, so that it doesn't reabsorb. Because that's another little known fact is that estrogen, once your liver does all this work to process it up and package it up into a nice box, tie it up with a bow, if you don't excrete it, your body actually takes it and reabsorbs it for use. So then you add to that estrogen load again. So it's really important. Then just being aware of even things like xenoestrogens, estrogens that are out in our environment. There was a lot of talk about that a few years ago with BPAs. BPAs and hard plastics came out, and the lining of cans. That is actually a very strong xenoestrogen. And what that means is an estrogen that it's a molecule that mimics estrogen. So it can bind to our receptors just like our regular estrogen that we produce, which isn't a good thing if you already have an imbalance. So you want to try and minimize all of that in your environment. And those can be in things like our cosmetics products, our day-to-day products, our cleaning products, plastic and food containers, even receipts. If you see the receipts that are glossy, that has a source of xenoestrogens on it too. So it's literally round. So a lot of it's education, looking for those, being able to reduce those. And then there's a lot of supplements that you can do to help boost your estrogen levels or your progesterone levels, such as Vitex, which is chasteberry, can help with that. Other supplements can help with the metabolism piece calcium D-glucarate, DIM, IC3. So there's different supplements that can help with that as well. And then,
I love that.
yeah, there's so much. I could just like keep going on, but like, yes.
Well, sorry, I didn't mean to interrupt. One thing that came to mind that I always, pattern recognition for me as well is the low progesterone. Interestingly, what you're describing is that when your progesterone is low, it can look like you're in estrogen dominance, which is a very catchy phrase these days, which doesn't necessarily mean your body's making too much estrogen. It could simply mean that your body's declining its progesterone production.
Yeah.
And you're describing these beautiful ways to make sure that you don't get into additional estrogen overload, either by not detoxifying estrogen enough or adding more of those estrogen lookalike molecules as, estrogens. I also think, and I don't know if you would agree, that another reason that many of us may be experiencing more early and more severe perimenopause with that more aggressive decline in progesterone is that stress, that like either a sudden, sudden acute stress or that more common low grade everyday stress can actually drain your progesterone because your body needs to make the cortisol hormone, which uses progesterone to make it. What do you think about that?
Yes. And I talk about that. Thank you so much for bringing that up. It's like I can't tell you a single woman who I see who has not had some sort of taxation on her stress system, her cortisol system. And when you think about this stage of life, it is like the busiest time of our lives. Many women are at the peak of their careers. Many women have young kids. Some women I always joke that perimenopause often happens at the same time as when many women have kids who are going through puberty. So you kind of have this double storm going on at the same time. But that being said, it's a stressful, busy time of life. And there's a certain mindset that, I think a lot of women who just manage, we persist and we push through, and that persistence actually creates even more stress. So I can't think of almost any patient of mine I've not checked, who has not had some sort of dysregulation, let's say in their hypoadrenal cortex axis, let's call it cortisol dysregulation, let's call it that. And when you think about the way our bodies look at hormones, it's not so black and white that it's like just one thing and then it affects another. Hormones are like a net in our bodies. You affect one area, all of the other hormones get affected. But I do say that there is a hierarchy and there is a preferential sort of way that your body will look at hormones. The first and foremost being cortisol and insulin, because those are your stress response hormones, your fight or flight, your survival hormones. So your body is going to want to preferentially, evolutionarily, we've evolved to this, prefer those hormones over reproducing. There's no point in reproducing if you're not surviving. There's no point and on top of that, if you think about it, there's no point in digesting if you're not surviving. There's no point in having an active metabolism and gaining weight if you're not surviving. So at the top is really cortisol and insulin, your survival. Then you have your thyroid hormones for metabolism. And then you actually have your sex hormones, your estrogen, progesterone, and testosterone. Because you can only think about reproducing if you're already in a thriving environment. So to your point, when cortisol is being taxed and there's a lot of demand on that particular system, if you look at biochemically in our body, how we produce the sex hormones and cortisol, it's this really complex chart, but they're all connected. They're all linked, and it actually all comes from cholesterol. But your body will preferentially make cortisol and steal that away from progesterone in order to make cortisol. So that definitely widens the gap and the imbalance even more. And I think it's also important if we ever do talk about just replacing progesterone, that cortisol piece is addressed. Because if you just go ahead and start progesterone replacement, that without addressing that cortisol piece, a lot of times some women will feel worse because they get all of a sudden this extra cortisol, and then they're even more revved up and you get the symptoms of hypercortisolism and then the imbalance on top of it. So
Oh
it
my goodness,
really
it's
takes
so
a
true.
whole approach.
It's so true. Yeah, if you don't address that stress piece with your third pillar, which is the mindset reset, then what's going to happen is whenever you add progesterone, through pharmaceuticals, your body's going to go, great, we have more progesterone to make more
like
cortisol.
fuel to the fire.
Yeah, and cortisol is so inflammatory. So now you've actually created a new problem, which is even more, cortisol, which may delay the point at which you hit burnout. But that additional time before you hit burnout, because you're able to make more cortisol, means more inflammation. So you will eventually still hit burnout. You're just going to have a more inflamed period in between those two. So I
And you
think it's
might get more disease, right? We know inflammation leads to disease, and that's where you get to metabolic dysregulation. You might have even more symptoms, more actual diseases, and then you can get thrown more treatments from a symptom management point of view, which can oftentimes complicate the picture. So it's a slippery slope, but that's why I think it's so critical to look at all aspects, all the hormones.
I agree. And why it really, sometimes people see the word mindset and, even mindset reset, and they'll just gloss over it saying, yeah, I know about that. But do you really know about that? Because I started experiencing what some would call perimenopause symptoms in my early 40s. I was 43 at the time, and tuned into myself. I did the body attunement, and I thought, my family history is that my family goes through perimenopause in their early 50s. This is a bit early for me. What could it be? It was signs of low progesterone. I was getting more problems with sleeping. I was spotting, a week or two before my period when I usually wouldn't spot. Things were getting a bit heavier. And I checked in with myself and I was like, I'm eating really healthy. I'm exercising. I'm sleeping. I think that what I have on my plate is overwhelming my capacity to stay at a good level of the stress response. And I had to reset my mindset, shift my priorities and get rid of things that sure I could handle, I could do, but did I really need to be doing them? And when I got rid of those things, although externally it may look like I might have been giving things up and doing less, in our ambitious society, it doesn't seem so great. What it allowed me to do was to, relax more into what I kept on my plate and start to truly enjoy those things and the space around them.
Yeah.
And within a month, everything normalized. My sleep went back, my periods normalized, and knock on wood, a few years later, I still haven't hit perimenopause. I'm still in my late reproductive stage, which is kind of amazing to me that third pillar that you're talking about, that mindset reset, was what I needed. And if I had gone to a, doctor who was trained in hormone prescription therapy, bioidentical progesterone even, and all I had done was take the progesterone, I might have missed this opportunity. Now, if I did all the things and I still didn't experience a shift and things were progressing to the point where it was problematic, probably would have taken that prescription. But before that, the steps before that, the integrative functional medicine approach is to really look at those root causes. So I love that you have mindset reset as one of your core pillars.
That was such a beautiful example of so much self-awareness of what you were going through. And I wish everyone had that amazing self-awareness to check in and say, okay, my lifestyle is good. What else is going on? Because really, I'll be honest, a lot of times, and myself included, I don't think I realized that how severe sort of down that path of mindset shifts and how much I needed to make the shift in order to feel better. It was almost when things were really, really bad that you kind of, the light bulb goes off and you're like, oh, I put two and two together. So that's beautiful. The other thing you said that I loved is really, yes, the lifestyle changes are going to be your foundation first and foremost, always, because your hormone levels are going to change. All of that's going to change. But what's going to carry you through till ripe old age is really all the lifestyle and mindset. And I really feel like our society is just really driven. I can't tell you how many women I see, like they just don't focus on themselves. It's like energy out constantly. So it's energy for your kids, it's energy for your partner, it's energy at work, it's energy to your friends. And part of like one of the big mindset shifts is like, okay, let's just have some self-compassion. Let's put some boundaries out and say, what do I need right now? And perimenopause is such a beautiful time because I think if you weren't ready to make those shifts, your body's going to make you ready. It's going these changes. And that's why I think it's such a natural progression, because the physical changes really force you to stop and say, okay, I need to prioritize sleep. And that might come at the expense of saying yes to all of these engagements that I want to or thought I need to participate in, and really evaluate what's important and what's not. Even with your kids, for example, like sometimes you're like, I need to stay up and I need to do this. But I'm at the point right now where I'm like, okay, you need to learn how to get yourself back to bed, or get yourself in bed at a decent time, because I'm going to bed.
Yeah.
Prioritize my bedtime. So part of it is just putting in the boundaries, knowing what you need to fit your situation. So I call that like the self-compassion set, really being easy with yourself. Not another big one is what I see so commonly, especially when it comes to the weight gain, is the doubling down. We were just talking about cortisol. So how many times do I see a woman who's like, we do HIIT and like we love HIIT when we're young and high intensity. And then when the weight starts to increase a little bit in perimenopause, it's like, okay, I'm going to just work out harder. I'm going to restrict more. And all that does is it's telling your body food, like if we think from a very primitive level, you're running from a threat, you're doing high intensity exercise to run from a threat, and food is not readily, abundantly available. It's scarce. So your body actually goes into survival mode, and that whole cortisol demand gets heightened. And that throws your hormones off for a loop even more. So oftentimes I talk not only about just being easy on your body and giving yourself that break, and really what I call safety signals. What safety signals do you have to give to your body right now? And that could just be, I'm going to walk. I'm not going to do these high intensity exercise. But that takes a lot of mindset shift to just really prioritize self-compassion and ease over the pushing.
Oh, I agree. And I'm curious, actually, I think this ties in really well with your fourth pillar, the advanced longevity. I was reading your write-up about it, your description, and a few things really popped out at me, like mitochondrial health and, what are your strategies around that piece of, okay, now we've tuned in to the fact that we need more support. Our body is changing. It has different needs. What can I do to support that advanced longevity, that health span?
Yeah. I mean, when you're in talking about the longevity space, it seems like it's all coming down to mitochondria. The mitochondria are the little organelles in every cell that are the powerhouses. They make ATP, and that is what gives us energy. And we know that the mitochondrial health is also really important for like antioxidants. What's the word I'm looking for? See, perimenopause.
Is it what helps put out inflammation?
Yeah.
Put out inflammation in the body?
Yeah, essentially it'll come to me. Anyway, we also know that mitochondrial health and the health of your mitochondria is associated with aging. So really, part of what advanced longevity, and the reason why I put it in this phase is because you really have to feel well, and you really have to have that cortisol piece tied in, because what we're going to do, how our mitochondria improve is really based on stress and the concept of hormesis. Hormesis being, in layman's term, what doesn't kill us makes us stronger. So how can we stress our bodies in a controlled and supervised way in order to help our mitochondria become a more number, last longer, healthier? And part of that is things that we can look at would be like cold therapy, sauna, heat therapy, looking at even things like intermittent fasting or high intensity exercise. So all of these things can help with longevity if done at the right time and in the right setting when your body is not taxed. So it's really important that it comes at a later phase. Whereas I think where a lot of the confusion can happen right now is it's like, okay, well, I want to have longevity. I want to do this. I want to do all of it. And part of it's like, no, you should not be fasting for 24 hours right now. Later, absolutely, could be helpful, but you need to know when and how to do it. And so part of it is, advanced longevity can also be looking at optimizing your microbiome. And how can we do that? We know the importance of microbiome at this point now for everything, for your brain, for thinking, for weight loss, for really your microbiome is tied to probably all areas of your body. And so then how do you support that? So there's so many little areas that we can look into that are going to be personalized. And I think that's what the important part is prevention is not like a one size fits all. So it really depends on where you are and how can we personalize longevity for where you are at that time.
Yeah, no, and it's so interesting because the mitochondria, correct me if I'm wrong, the sex hormones are made in the membrane of the mitochondria. So mitochondrial health is so key for hormone health. And what strikes me here is that people get confused sometimes saying, well, I'm hearing that high intensity interval training can be harmful for my hormone balance, and yet high intensity interval training is good for my mitochondrial health. And it's really about taking a big step back. And as you say, what's the overall picture here? Was that strategy working for you? And if it's no longer working for you, what part of this is unbalanced? Is it too much stress? So are you over exercising, under eating, and not sleeping enough? Mm-hmm. Are your caloric intake, is that matching the amount of energy you're expending? Is your to-do list overwhelming your cortisol response and that balance? And so it's really not so much about these black and white concepts, but it's about understanding that there are some core pillars that we can rely on, like exercise can be good if it's not underdone or overdone. Eating is good if it's not overdone or underdone. And then there is some devil in the details within that. But can you recognize that these things are important? It's important to, once you're in a good place, to then shift your attention to that, gut microbiome health, to making sure your mitochondria is being, nurtured well. And there are strategies that can be learned. And the point is they need to be learned at this point in time, because what you don't know can kill you. Unfortunately, there are things in our daily habits and lifestyle, modern lifestyle, that are harming our mitochondria and our gut health. And so becoming aware of what those are and, implementing the strategies, and then if needed, doing the more personalized testing, as you say, with, let's say, gut microbiome profiling, for example, can be very helpful for few people, for select people, right? So absolutely. Would you agree with that? Or?
Yeah, no, 100%. I think what you said about like personalization is so key for this. And, even things like water too much can be harmful, right? It can cause hyponatremia or low sodium and can cause seizures. But so nothing is ever black and white. And I think this is where having a guide is really important. Having somebody that you trust that can help review your own personal data is so super, super important. And then really knowing where is the next route to go, like to explore. Because when you get into this longevity space, you could really go everywhere. Like it's massive. And, I'm still learning so much, which is fascinating. And so part of it is oftentimes I'll have patients come to me going, what about this? What about this? And then I go down the rabbit hole of researching and looking up stuff, and it's a learning process. But, how do you sort through all the weeds to get to what is important, for sure?
I love that you mentioned that. And I think that when people are asking me, well, how do I find a doctor to work with? What are the criteria and credentials that I need? What I think is, yes, it's great if they have formalized training in integrative medicine or functional medicine. But what you just described, that attitude of, if I don't know it, I'm going to look into it. I'm going to read about it. I'm going to educate myself so I can come back and tell you, what I think, as opposed to what I quite honestly was doing before I went down this road was just to say, I wouldn't even say I don't know about this. I don't know enough about this to give you an opinion. It was more like, I wasn't taught about this in medical school or in my training, so it's probably not important, or don't worry about it. We're going to focus on these things. And so finding a health professional like yourself, like myself, like many others, and this really touches on that last pillar, which is connection. For me, what helped me progress through burnout was to feel connected again to a group of like-minded individuals, people like yourself, the people I work with, the clients and patients. Having that perspective on health has been really beneficial for me. And I imagine that when you speak to your clients and your patients, how do you introduce the concept of connection and how that comes into this idea of ageless alchemy?
Well, I think connection really is the glue, right? There's that Harvard study, that longitudinal longevity study, and it came down to where they followed the people over, what is it? I think they're still running the study. It's now into it's something at year, and they basically have come down to it's the quality of your connections above all else, above all the stuff that we're talking about, longevity and mitochondria. It comes down to the quality of your connections. And I think we're at an age where we have so much available from a connection point of view, even if there isn't anybody in your vicinity, and feeling like you're not alone going through this process. I think one of the biggest things that I feel like I can provide to my patients is just to validate that they're not, what they're experiencing is valid. It's true. It's not just them. But then also I see so much value when everyone connects with each other and is able to share their own stories. When I give talks, what I find that women love most, I'm yammering around and explaining the science behind it, but what I find that they love most is when they start talking amongst themselves and sharing their own experiences. And it just becomes this, you can see the energy in the room just change. So there is so much power in that. And then where it ties in with the Ageless Alchemy is because when you step back and really look at why are we doing this? Why are we trying to live with this amazing quality of life and longevity? It's all good to achieve good numbers on your blood work and do all of that. But ultimately, it's I feel that we have this purpose. We're on earth and we have something to share. And whether that's whatever it is, be doing what you do in work or being with your family, being able to do that well and really put out that purpose is where I feel the power comes in. And so when you connect with other women, with other people, it allows for that to happen in such a powerful way. And so really the root of Ageless Alchemy is is to get you feeling to a certain point so that you can really put out your purpose. And that purpose really, I feel gets supported so much better when we have that connection in that group.
Oh, I agree. It's interesting because connection is a treatment and a motivation. When you feel connected, you release a lot of that oxytocin hormone, which is a really great antidote to the cortisol hormone.
Yeah.
Right. It's hard to be in over cortisol production when you're in oxytocin production, and when you're connecting with people, that's what you're doing, right? I'm feeling here a rush of gratitude and just, thankfulness. And that really, I can feel myself with my body attunement that I relax into this moment. And it's just such a wonderful feeling. And that is translating into hormone balance and all of those things. And it can be very motivating, as you say, to have a reason as to why. Why are we going to change our lifestyle? What's going to, motivate us to get to bed and to make those healthy choices? Ultimately will come down to, as you say, that purpose that we have, which usually is related to how we help and are of service to others. So when we are feeling very unwell,
you can't do it.
You can't do it. You get into a selfish state, right? You get internally focused while you're still trying to focus on other people.
Or you feel guilty that you're in a selfish state, but you feel guilty about being in that selfish state. And so then it just feeds itself. Yeah.
Absolutely. And so having connection along the way and as the goal and the end can really lift you and, make that whole experience feel better and the outcome much better. So I appreciate that you have that. That's a very integrated approach to, that mastering that midlife shift in terms of our hormones and so much more. Hormones is a catchy word these days. It is so much more than that. So I appreciate that your pillars, or your phases as you call them, really address it all. And if you can touch on those things, you pretty much have that roadmap that you need. And so what I want to do is I want to share with people how they can reach out to you, because you practice in Ontario, Canada. And can you explain what your practice is like in this integrative hormone health aspect?
Yeah, so I'm in Toronto, and essentially I do an integrative hormone practice where the first appointment is really, a full detail. I want to get to know you, the ins and outs of not only your health, your family history, but also your lifestyle. I want to know, like, when the alarm first goes off, like, what's your day look like? What is a typical day? What are you eating? How are you moving? What's your sleep in? How is the stress going? And we really flesh out all of these details in addition to what you're experiencing, so symptoms. And then really what I do is I send for a pretty complete lab panel of everything. And there's a lot of talk out there as to, well, in hormones, you don't need blood work. It's all symptom based. Absolutely. And we didn't actually quite get on this topic, but I think it's really important, to make sure that there isn't anything else going on. And part of that means making sure there's no anemia, making sure there's no baseline disease, there's no big deficiencies. I can't tell you how many vitamin D deficiencies I find.
Oh my God, you can see my face right now. And it's my number one deficiency in my clinic.
I know.
Did you know that the reason that the Canadian government doesn't pay for vitamin D testing is because they assume that everyone's deficient unless they supplement?
Yeah, exactly. And if you look at the recommended amounts of 1,000 units, it's really a drop in the bucket. I mean, we give our newborn babies 800. And so to think that just 200 more for an adult is fine. I can't tell you how many people I find that are deficient, even though they're taking their 1,000 units. So just things like that. I think it's so important to have a good baseline. And then I really look at metabolic health, because the one thing we didn't touch upon is the metabolic dysregulation that can start to happen in perimenopause, that really those slow imbalances and that cortisol imbalance and the declining estrogen eventually does certainly lead to increased insulin resistance and in diabetes. And that changes, that results in a lot of changes and can result in chronic disease. So establishing that good baseline now. And I pick up on early changes. Yes, they're not diabetic by any conventional standards, but we're talking about how do we optimize here and how do we prevent? So really looking at that. And then when I get those pieces of data, I can really put together a personalized approach. So knowing what your day-to-day looks like, knowing where there might be areas that need addressing, I can say, okay, here's your full roadmap. This is where I think we need to target first. This is what we're going to do. These lifestyle changes we're going to try and put on. And part of me is just like a collaborative approach. I don't know exactly what's going to work with you. And I think it's really important that I always say, like, just try this on. Try it on. If it doesn't work, we're going to figure something out. But you're going to work with me, because I don't know what's going to necessarily work. I might have suggestions, and you might say, no, that absolutely doesn't work. Okay, we'll figure out something else that can work. And it's this collaborative approach that really, I think, if you can establish a good baseline of lifestyle changes, I can recommend certain supplements that will help ease the change. And then if we need to, medications on top of that. But it's really this layered approach.
I love it. Well, thank you so much, Dr. Angelina Yee. I'm going to put her contact information in the caption below. In the video, you have to click on the more below the video. If you're on the podcast, check that out. I also wanted to mention that, as Dr. Yee has alluded to, that we are kind of scratching the surface on certain topics. If you want to dive deeper, go to my YouTube channel, check out my Peri/menopause playlist. I go into root causes, natural solutions, and I'll be sure to invite Dr. Angelina Yee on again to, go into certain specific topics. In fact, if you have any specific questions, feel free to put them in the comments below the video on YouTube. That's where I like to go in and get ideas for future. If I can't answer it quickly or shortly, I get these ideas for future episodes. So be sure to put them in. Dr. Yee can also pop in there and check them out. And if you enjoyed this, please go to my channel at dr.patriciamills and subscribe. Save this for future reference and share it. Sharing is caring, and you never know when someone's going to benefit from this wild wisdom. Dr. Angelina Yee, thank you so much for joining us today. We really appreciate you taking your valuable time, truly, to share this very important wisdom with us.
Thank you so much, Dr. Patricia, for having me. This was so much fun. Loved it. Thank you.
Likewise. Have a wonderful rest of your day, evening, or night, depending on when you catch this. Bye now.
Bye.